Welcome to the World of Rare Disease, a show that focuses on awareness and education about rare and complex disorders. My name is Lisa Deck, and I am a Rare New England committee member and your host for today's show. Today's guest is Kathleen Swenson. She has 16 years of experience in genetic counseling in various clinical settings across many specialties, including prenatal, pediatrics, neurology, and cancer. Kathleen is an experienced education and clinician across a broad spectrum of genetic counseling domains, ranging from prenatal genetic counseling to the development of a telephone-based counseling platform. Kathleen is presently the program director at Boston University's Genetic Counseling Program. Today's show will look at the practice of genetic counseling and the role it plays in the life of rare disease patients. I'm so pleased to welcome Kathleen to our show. Thank you for being here.
Thank you, Lisa, for the introduction, and it's a pleasure to be here today.
Excellent. Well, we're going to jump right in and get started. You have so much information in that head. We want to share it with our viewers. So can you first tell our viewers, what is genetic counseling?
You know, that's a really great question. That's actually a question I ask my students to often think about for themselves. What is your personal concept of genetic counseling, and what is genetic counseling? And I think, you know, one of the unifying definition that many of us often think about is that we are healthcare providers that work with individuals who are interested to understand how genetic conditions perhaps travel in their family or can affect their own health. So we're educators. We're also supportive individuals. We support healthcare professionals. We support laboratories. We support research, and we work as team members in this space. The counseling aspect of genetic counseling is really unique to this field because individuals are trained to work with patients, work with families, respond to a lot of the emotional experiences that the individuals we work with experience. And so we can provide that emotional support and that psychological support to our patients just the same.
Excellent. So this question you kind of have answered, but why is it important and what benefits does it bring? Because I think for a lot of people, even myself as a long-term patient, I didn't really know there was a combination between genetic testing and genetic counseling. And I think that's so important to explain.
Yeah, genetic counselors are often very helpful in bridging a lot of the multiple pieces of the complex care that families are experiencing. We might be part of the medical home if someone is within a department of genetics, or we may be a helpful point person if someone needed copies of test results or a letter to share the information with family members or to share information with schools, for example. So the value that we bring is our expertise in really understanding the genetics of the condition, the clinical manifestations of these conditions, how that can differ from family to family, and we can help communicate that to other people just the same.
So I think the obvious answer to this question is, who does that help? It helps the patients, but I think there's more to it than that. And I wanted you to touch upon that for our viewers, please.
Of course. Certainly we want to facilitate supporting our patients and our families, but we can also help the healthcare world understand more about these rare diseases also. So working with a primary care physician, or a pediatrician, we can help provide education to those individuals. We can help liaise between the laboratory tests that a patient might be receiving that might indicate that they have a diagnosis, at least on paper, of a genetic condition, and sort of translating that complex terminology on the actual lab report back to the patients, but then again, also back to the other members within their particular care circle. I think we do a really good job too of advocating, and again, raising that awareness in this space and the importance of, recognizing the impact of rare disease and the impact of genetic conditions to so much more than just the individual, but the family and the family unit as a whole.
Right. And as I think about it, it seems to me that you're a critical piece of a team. It really seems like as a counselor, you become part of the team between a geneticist, their medical doctors, and the patients and families. And so say I decide I want to talk to a genetic counselor, what are some things that I should look for? What is, How do you match up? How do you find it? Can you tell me a little bit about that?
Sure. So genetic counselors often work as part of a broader team, yes, but they can also work independently as well. Many are employed at local area hospitals, or they may be employed through organizations, nonprofit organizations, for example. Some genetic counselors work within advocacy groups specifically. There are others that may work within the laboratory space or within the public health space just the same, and some have their private practice. One of the best ways to locate a genetic counselor in your area is to search the National Society of Genetic Counselors, or nsgc.org is the website, and you can actually search by zip code for a genetic counselor in your area, and it will populate with who is geographically in that area. It will also populate with who can provide telehealth services for that area due to professional licensure requirements. So that's a great way to identify where you could find someone who's board certified and, again, able to work with you and your family.
Excellent. Now, this isn't a question I mentioned in advance, but I know, for example, when you talk about mental health and that there's always kind of a relationship that forms between a counselor and a patient, or a counselor and a family. Do you see that with genetic counselors as well? Does there seem to be a connection between certain ones that work better for some different patients? Like, for example, does somebody specialize in pediatric, or does somebody specialize in cancer? I'd love to know about that.
Yeah, that's so many genetic counselors do focus on a particular field of practice, and that might be in the prenatal preconception space, it might be in the pediatric space, it might be in the rare disease space in a real specialty clinical setting. It may also be more broad, so individuals who cover multiple specialties. And when you go to search for a genetic counselor through the Find a Genetic Counselor tool, it'll actually list what their particular specialty is. So if you were looking for someone that had a focus on, I'm just going to pick without reason these conditions, but neurofibromatosis or cystic fibrosis, for example, if you were to type those in, it would populate who really has that perhaps clinical focus just the same. Similar if you had a family history of colon cancer or ovary cancer, because it is Ovarian Cancer Awareness Month, you could see who has a cancer expertise just the same. And depending on the needs of the patient, of the family, and the circumstances, sometimes you just meet with a genetic counselor one time, and sometimes you do develop more of a longer standing relationship if you're going in for follow-up care, if you're having genetic testing for yourself and you're coming back in for follow-up to get those test results or to understand what all this means, even if those results are negative. So sometimes it's multiple visits, but sometimes it's just one visit. And I think, again, it just depends on the circumstances of that particular, the patient and the family at that time.
Right. I'm guessing, like rare disease, there's 7,000 rare diseases. So I'm guessing every situation is different when it comes to genetic counseling. So I'd love for you to tell us what your current role is and what you do in your current role, kind of switching. So let's learn a little bit more about you and what you're currently doing. And then I want to get into what you've done in the past, because I think it's so interesting to see how your career came to be.
Sure. So I currently am the program director for the master's training program for genetic counseling at Boston University School of Medicine. There are currently 51 accredited programs in North America, so 4 in Canada, the rest in the United States. And I currently oversee really the training of the future genetic counselors that at least come through our program. And it's an honor and a pleasure to be able to be part of that journey and that experience, and also to think about how is genetics changing? How is our knowledge changing? Each and every day we're identifying new scientific discoveries, and the we being scientists and healthcare providers, and we're just understanding more and more about genetics. And so making sure that the graduates are prepared for this forever changing space is really what we really want to focus in terms of how those students go through their training. Because of accreditation, all genetic counseling training programs are required to cover certain entities within the field, making sure that graduates are competent within their competent in sort of that development of the genetic counselor skill set. So when they graduate, they can start taking care of patients, families, working again on that team, working collaboratively, and contribute into this field even further.
Excellent. And I'd love for you to tell us a little bit about the various settings you've worked in. So you've been in practice for years, and I wanted you to touch upon some of the different things. I know in our other episode, we're going to dig a little bit deeper into kind of genetic counseling and the different career paths, but I think it's really interesting to see how many different things you've done over the years.
Well, thank you. So I found out about genetic counseling when I was a junior in college. This is a typical story of many genetic counselors not knowing about it until a little bit later in their sort of educational pathway. And I actually learned about it from my high school biology teacher. So it's sort of random that all happened, but I was really excited about the field because of the combination of science and also working with people. And it was a very special place for me personally, just the same. And so when I graduated my genetic counseling program, it was actually back in 2000. And I started working in prenatal genetics, high-risk genetics, high-risk prenatal, excuse me. So taking care of women who might have a certain health condition that would put their pregnancy at high risk, or maybe their pregnancy was identified as having some type of ultrasound finding or significant developmental difference in terms of the physical development in utero. And so wanting to follow those patients really closely post-delivery and throughout their pregnancy. At that time, a lot was going on with genetic carrier testing and other types of testing that women were receiving during pregnancy. And I was part of some research studies really looking into the nuances of that. About 7 years after getting started in that prenatal space, I started teaching, and I took a professional pivot and went over to pediatric neurology, working side by side with a child neurologist, starting up a program specifically within neurofibromatosis, but also supporting families with a strong history of autism, epilepsy, undiagnosed muscle weakness, etc., trying to assist the neurology providers within that department and thinking about any kind of testing or what kind of recommendations we would have for oftentimes their child, just given the scope of being in that space. Due to just relocation, got involved with cancer genetics. It wasn't intentional, but neurofibromatosis does have a predisposition to certain cancers, and so it was sort of the natural segue. I've kind of gone through the life cycle, I feel like, in a lot of ways. But in the cancer space, I'm really working with hereditary breast and ovarian cancer, hereditary colon cancers, individuals wanting to understand if they were at greater risk, if they had a strong family history. And that really allowed opportunity to also get involved with some additional research and some additional advocacy organizations. And then a lot was happening in, about 8 years ago with the wide availability of gene sequencing, which was a technology that never existed in 2000 when I entered the field. And so you may be familiar with gene sequencing just from your own experiences, but because this became so widely available, a lot of companies started to grow from the ground upward, wanting to offer more broader genetic testing and more broader counseling services, what we would say at scale, so to a wide population. And so I was invited to get involved with a startup company, really looking at new platforms to deliver genetic counseling services via telehealth. Also think about how we could get test results out to patients quickly that were helpful and informative, and also how to help the providers adjust to all this new information. And that was really a very exciting and invigorating part of utilizing so many years of being in the clinic and trying to apply all that I learned from the patients that I was privileged to work with during that time in sort of thinking about this framework from a telehealth perspective. And I think now in our current state of 2020, where we are, a lot of healthcare has pivoted over to telehealth. And so it's nice to have some background experience in that space to think about again, how in 2020 telehealth has really taken off, especially in genetics care, but also across, much of healthcare. So it's been a really exciting career path, and it's been, sometimes you don't expect these different tributaries to develop in your own career, but they just do, and it's exciting to try new things and again, see where the field is going. And in 2016, I took over my current educator role. I've been involved with student education for over 15 years, but as I mentioned earlier, I really value that opportunity to know that playing a part in teaching the future professionals in our field as well.
Yeah, like I said, you have touched upon everything. And I think bringing that wealth of knowledge is so important. And I think it's awesome that you're able to share that with students, which actually brings me to Rare New England have started doing some of the career fairs. And that's the idea of those, is to get students involved in genetic counseling. So there's more information about that on the Rare New England page, but I didn't mean to make that segue. However, I think it's so important. It's funny, I have so many questions, but I do have a script to stick to because we're not going to go over our time. So I think you had mentioned it, but as a patient, I'm interested in getting some genetic counseling because I decided I'm going to go for genetic testing. What is my first step?
Sure. So often, what is my first step? So certainly, because of health insurance, you may need a referral to meet with a genetic counselor. You may not need a referral, but you could always speak with your primary care physician or your whoever's taking care, managing your symptoms to ask if they have, if there's a available resource within the sort of that health organization that you're already part of as a patient. And if there is not a genetic counselor where you are sort of within that organization where you're part of as a patient, you can again always work to find somebody on the outside. And many times it's actually quite easy to get a referral for services. So I think it's just important to again work with that primary point of contact and be the patient that's advocating for yourself and asking, I'd like to go do this. And I know, especially working with the families I've worked with for so many years, the advocacy and the ability of families and patients to advocate for themselves is significant and tremendous. And so this is just another way I know it can get tiring, and I say that as a parent myself, but certainly it's just one other question to ask. Like, I'd like to go see a genetic counselor. This is why. How can you help me get to that professional? And hopefully they can give you some tools, or you can go to them with some tools that we talked about earlier in this recording.
Right. I think it's so much to take in. And interestingly enough, I have not had genetic testing despite having a rare disease. And I think part of that, they don't know for sure if my disease, some of it is genetic, some of it is not, or it seems to be proven that way. But there's also a little fear in me. And I think now knowing that genetic counselors exist, that they can help me through it, because my fear is getting this piece of paper that is so daunting, so terrible, so overwhelming. And what do you do? So it's interesting because I've been in the rare disease space for 5 years and a patient for 20 years, yet I never really knew this existed. So I am thrilled to be sharing this with viewers because I don't think everybody necessarily knows. So it's really important for people to learn about genetic counseling and what they can help and provide. Do you have any final words for our viewers talking about genetic counseling and the importance and things like that?
Sure. I just want to echo on your point of the fact that you have been in this space for so many years and have never had testing yourself, and the fear that surrounds that. And I think one of the, just because you're meeting with a genetics professional doesn't mean that you're on a path to genetic testing. It's really about discussing what are the benefits of testing. What are some of the drawbacks of testing? And frankly, what are some of the limitations of testing? Is there even a test out there that makes sense? There might not be. Is there a research opportunity that you could explore further? There might not be. And so sometimes it's just about here, I think what we do often is try to present to our patients in a kind manner, in a compassionate manner, recognizing how much everyone is balancing on their plate, what are the options? And again, it's more about that shared decision-making process and working with patients to figure out what makes the most sense for you and what makes the most sense for your family, because testing is not for everybody. And we recognize that wholeheartedly. And so a lot of people have that misconception that just because you're going to genetics, it means you're going to get testing and you're going to get an answer and you're going to get this, and this. That actually might not be the path. It might be a conversation. It might be a discussion. There might be testing options, but you don't proceed right then and there. You think about it. And then you circle back to it at a time that might be better for you. So I think it's just important to know that we're here to support everyone individually and everyone's needs individually, and there is no one size fits all. And that's where our training really comes in, because we can adapt to the needs of our patients and we can advocate for the needs of our patients and maybe help our patients figure that out for themselves too. I'm like, maybe I'm not as ready as I thought because I am really nervous, or I'm scared, or I have a big event coming up and just this isn't the right time. So I just want to get that out there, that our goal is to really be most mindful to what your needs are, not our agenda. What are your needs? And that's what we want to work with. So there you have it. I think, and again, if you are ever looking for any kind of assistance, there's online organizations that can help guide you to professionals in this field just the same.
That's excellent, because again, I think you're not just talking to me, you're talking to others, but I think how I feel is probably similar to a lot of people. So I think that is very reassuring and encouraging to know that, you're just making an appointment, you're just starting. It doesn't mean you're going down that road. Well, thank you so much for all this information. I think it's so valuable. I know to you, it's just your other language of speaking and just what you know, but it really is helpful to all of us.
Well, thank you for the opportunity to share more. I really appreciate it. And I really, I appreciate all the work that Rare New England does in this space as well to support everybody.
Thank you for tuning in. Before closing, we would like to explain to you our new Rare New England in Motion segment. R&E in Motion is the perfect way to expand upon our mission of engaging with our community. We are continuing to post our shows to the Rare New England YouTube channel and on our social media links. Once a month, we will take a show and a guest to come live on Facebook. During these sessions, we will run our show and have the show's guest live to answer viewers' questions. We will continue to promote our Facebook Live events on our social media channels and via email. You are welcome to submit questions to Rare New England and our guests to our email, info@rarenewengland.org. That's our show for today. Thank you again to Kathleen for being our guest. She is so wonderful, and it's so nice to hear all that she has to say. From all of us here at Rare New England and all the patients and families who keep rare disease in motion, thank you for watching. And remember, when you hear hoofbeats, think horses, then think zebras. Thank you.